Hey Birth Institute, this is Abigail Lannon Eves, Certified Nurse Midwife and Executive Director at Dada Luz Birth and Health Center. We have celebrated our 5th year and are about to celebrate our 500th birth here at the Birth Center, and we are super busy here in the land of enchantment, and we are really sorry we're not there with you in Pittsburgh. We are delighted to be honoring Dr. Leeman with the Collaborating Physician Award. Dr. Leeman is currently the Director of Family Medicine and Maternal Child Health at the University of New Mexico. He has been the Managing Editor of Advanced Life Support in Obstetrics, Medical Director of Milagro, a prenatal and maternity clinic for women with severe substance abuse. He is also the Co-Medical Director of the Mother-Baby Unit and the Intermediate Care Nursery at University Hospital, and he is our lead consulting physician. Dr. Leeman has been a champion for women and babies for as long as he has been in medicine. After graduating from medical school in 1998, he completed his residency in family medicine at UNM. He then went on to practice at Zuni, a rural Indian reservation about 150 miles west of Albuquerque. He said, "The experience of working in the birth center setting at Zuni helped me to see that all women don't require a hospital for childbirth." After 6 years at Zuni, he left to receive his fellowship training in obstetrics at the University of Rochester, returning to UNM in 1998. He then stepped into the director role of family medicine in 1999. I met Dr. Leeman in the fall of 2001 during my student midwifery intrapartum rotation at UNM. I had already heard about how much he supported the home birth community midwives and was an advocate for safe out-of-hospital birth. When I met him that day, I remember how he greeted me. He was just downright nice. I told him that I was planning to open a birth center in a few years and wondered if he would be willing to be part of this center. His response was, "That's great. Every year a midwifery student tells me she's going to open a birth center." And my colleague Tanya, standing by my side, quickly stated, "But the difference is she'll do it." To which Dr. Leeman replied that of course he would be part of this endeavor, with a large smile on his face. I met with him again several years later in 2007 as we were in development, and he was still committed to helping us in any capacity. He worked with us while building our foundation and development between 2007 and 2010 and has been our lead consulting physician since we opened. Through our work with Dr. Leeman, we have been able to finely tune our clinical practice guidelines, especially around transfer. He pioneered the change within the labor and delivery unit at UNM about using the phrase failed home birth or failed birth center birth, taking away the negativity that surrounds words like failed. And with this, he has set in motion a cascading effect of positivity towards mothers who are coming to the hospital when it is the very thing that they fear the most. The first thing he will say to a client is, "I'm sorry you couldn't have your baby at the birth center," and he means it. And our mothers know that. I continually watch the anxiety drift away from their faces once they meet him and they feel his presence. And he continues this advocacy on a national level through his work on the Home Birth Summit and sharing our model of collaborative care with other professional organizations. I often say that Dr. Leeman is more of a midwife than many midwives I know. My belief is that midwives are the protectors of mothers and babies, and I believe that midwives should always honor the process into motherhood through all stages, continually supporting women without judgment, even if we don't agree with some of their choices. Dr. Leeman does this, and he does it with compassion and empathy. He truly listens to women and guides them with knowledge and grace, continually adjusting his practice to meet the needs of the ever-changing philosophies and beliefs of not just our clients, but his own. We are so thrilled that Dr. Leeman was chosen for this achievement award. He is most deserving of this recognition, and I was honored to nominate him and honored to give him this award and to work with him in this capacity. Congratulations, Dr. Leeman.
Hi everyone, my name is Ruth Golar. I'm a certified nurse midwife here at Dada Luz Birth and Health Center. Just wanted to extend a huge congratulations to Dr. Larry Leeman. We are so proud and grateful for you. We couldn't be doing this work if we didn't have you backing us up as our consulting physician. I think we definitely have one of the best consulting and transfer situations in the entire country. We have so much gratitude for that, and we hear nothing but words of gratitude from our clients who have been the recipients of your care. Congratulations. We look forward to seeing you when you get back.
Hi, I'm Melanie Yank. I'm a certified nurse midwife and the clinical director at Dada Luz Birth and Health Center. I have had the privilege of being a part of Abigail's dream since the opening of the birth center in 2011, and have watched it flourish under her amazing leadership and the collaboration of Dr. Leeman. He's always there for us, no matter if he's out of town or on vacation. Sometimes he'll even take emails and always takes a text. This really gives us a lot of confidence to be able to serve our clients and know that we can have our questions answered at any time. More than that, he's also a mentor to us, and he's our friend, and we share the good times and the bad times as well together. But enough about us singing our praises for him. We'd like for you guys to hear from some of our clients who've received care from him after transferring to the hospital. So following are a few clips of our families, some as long as 4 years ago and some as recent as just this past week. Enjoy, and thank you, Dr. Leeman. Thank you for this award, and we're so honored to have you as our collaborating physician.
Hi there, this is Robin, and this is Asha. Can you say hi? Asha's about to turn 4 years old, and we had the privilege of working with Dr. Leeman during Asha's birth. We had planned a birth center birth at Darloo's Birth and Health Center, but unfortunately, due to her positioning, we ended up transferring to the hospital. But we had such a great experience with Dr. Leeman, and I especially appreciated that he spent over half an hour on the phone with me talking about all of my options. And when we arrived at the hospital, he and his staff helped us maintain that compassionate care that we had been receiving at the birth center. He is truly a beautiful bridge between out-of-hospital birth and in-hospital birth in our community, and we are so thankful for him and so proud that he is being honored. Thank you so much, Dr. Leeman. Can you say thank you? Say thank you. Okay, we're being shy.
Hi, Dr. Leeman.
Hi, Dr. Leeman.
Congratulations on your well-deserved award.
We just wanted to say thank you so much for the beautiful care that you gave our family during Priya's birth, especially after our significant birth trauma and losses in the past. Thank you for the grace that you gave our family and for giving us the exact beautiful birth that we wanted with Priya.
Thank you.
We love you.
We love you so much.
We are Amy and Erin Lavender. We had expected to have our birth at the Darloo's Birth Center, but some unforeseen circumstances required us to transfer to UNMH under the care of Dr. Leeman. While we were there, we felt very informed. We felt very empowered. We felt like all of our decisions were being taken seriously. I think that his presence is just so reassuring that we never felt uncomfortable while we were there. I know I hear a lot of women have depression or they experience birth trauma when something unexpected happens, and I've never had any negative feelings about my birth, even though it wasn't what we had planned, and I really attribute that to Dr. Leeman.
Hi, we're the Hanky V. Hill family, and we're really excited to be able to send a quick note of thankfulness and appreciation to Dr. Leeman. We feel like we received the best care from him. He was so encouraging and supportive and present with us when we were transferred to the hospital this last January.
He coordinated our care, he spoke with our midwives, he kept us in the loop, them in the loop. He knew what was going on. We couldn't have asked for a better experience. He just really is an amazing advocate for families, and especially our family. So thank you so much.
Thank you.
My name is Erin Saunders.
And I'm Chris Wood.
And this is our little baby Corliss. And we went into preterm labor. My water broke at 35 in 6 days. So we had to get transferred to UNMH from Darloo's, which wasn't our expectation, but that's what happened. So we arrived at the hospital. Dr. Leeman came in right away, He greeted us with smiles, told us that everything was going to be all right, lined out a plan for us, told us that we're going to be there as long as possible to get her. So we're going to try and get her to 37 weeks, so that she had better liver and lung function, so that her NICU, so that hopefully she wouldn't have to stay in NICU and she could just stay with mother and baby the whole time. We went into labor on we arrived on Wednesday, went into labor on Monday, and he pulled out all the stops for us. He got us a private room, he made sure that we were comfortable, he told me several times that I was capable of doing this, even though I wasn't necessarily sure if I believed it all the way. He made sure that she was safe, didn't rush her at all. We had to just push, for lack of better words, for
a little over 3 hours.
Yeah. He probably can account this better than I can, because
yeah, that was an intense part, but it went really, really well. Dr. Leeman was very patient, didn't, try to push us in any way, was very, very informative about all of our options. We ended up having to use the vacuum, but he was very, very forward about everything that could happen, and we just felt very safe the whole time, and everything went as well as it possibly could have, in my opinion. So
we got as close to a home birth and a hospital as possible, thanks to Dr. Leeman.
Good evening or good morning, depending when you're seeing this here. This is Larry Leeman. I'm the Chief Collaborating Physician with the Darloose Birth Center. I've been doing that ever since the birth center opened, and I also work some with other midwives in the community that have community birthing. I'm just so touched and honored by receiving this. I was fortunate enough to be at your conference last year, and I really wish I could be here now. I guess just to convey a few thoughts briefly. I've also been working with the Home Birth Summit group, and we've been working with women who are, and people that are trying to bridge the gap between community birthing, birth center, and home. And I think we're really starting to reach a tipping point, and I wanted to share that kind of optimistic view with you. I think that we're shifting the debate from where can women or should women have births to understanding that women need to have births where they feel comfortable, and really that the discussion needs to be looking at how to make that safer, how to make that a more supportive way. I got invited to talk at AABC last year on home birth, and I wasn't sure how that would go, but it went actually very well because we took a safety focus, and I was invited to come back and give the same talk again next year. So I think there's good hope on the horizon. I think the model we've done here has some special things that have worked well. Our docs are family medicine docs that are trained extra maternity and baby care, and so we collaborate both on the maternity and the baby part. Anyway, it's been a total pleasure to work with Abigail and Melanie and Ruth and Susan and Yelena, and to watch it grow. And they probably will have had their 500th birth by the time that's there, and I'm looking forward to the 1,000th birth. Thank you very much.